Our nation is sick. We face a health epidemic fueled by the overconsumption of sugar and sweetened beverages, leading to soaring healthcare expenditures and lost productivity, which endanger the financial health of our nation. Today's young people may be the first generation in the history of the United States to live sicker and die younger than their parents' generation. And if we don't do something to improve our health, our nation will go bankrupt trying to treat it. This is why my partner and I stand resolved that the United States federal government should substantially reform its revenue generation policies in ways which treat the underlying causes and not just the symptoms. Far too often, federal taxes focus simply on generating income. Today, however, the economy is in critical condition, so we need federal revenue generation policies to address the underlying issues. A primary factor in our nation's financial health, if not the primary factor, is a physical health epidemic resulting from substance abuse, which seriously impacts the health of a third of adult Americans. For today's debate round, we invite you to judge on the basis of net benefits. Does the plan proposed by the affirmative team produce greater advantages for the U.S. than the negative position? Now let me start by defining two key terms. First, sweetened beverages as defined by the Department of Agriculture. Quote, sweetened beverages are all beverages that are sweetened through the addition of natural or artificial sweeteners, unquote. Second, metabolic syndrome is defined by the National Institutes of Health as, quote, a group of factors that raises your risks for heart disease, diabetes, and stroke, unquote. Now let's consider the following facts, which link in this way. Healthcare is the largest single federal expense. Metabolic syndrome is our nation's largest epidemic. Excessive sugar consumption causes metabolic syndrome. Sweetened beverages provide most of the excess sugar. Fact 1. Healthcare is the largest single federal expense. Healthcare is the largest single federal expense. In 2008, Peter Orszag, director of the U.S. Senate Committee on Finance, testified, quote, future growth in spending for the federal government's major healthcare programs will be the most important determinant of long-term trends in federal spending. Changing those programs in ways which reduce the growth of costs is ultimately the nation's central long-term challenge in setting federal fiscal policy, unquote. Fact 2. Metabolic syndrome is our nation's largest epidemic. Metabolic syndrome is our nation's largest epidemic. In April 2012, scientific journalist Gary Taubes wrote an article for the New York Times entitled, Is Sugar Toxic? It reports, quote, physicians and medical authorities have come to accept the idea that a condition known as metabolic syndrome is a major, if not the major, risk factor for heart disease and diabetes, unquote. Taubes goes on to explain that sugar is also heavily implicated in the development of cancer. So how does metabolic syndrome develop? Fact 3. Excessive sugar consumption causes metabolic syndrome. Excessive sugar consumption causes metabolic syndrome. Robert Lustig is a professor of clinical pediatrics at the University of California in San Francisco. In February 2012, he and two colleagues published an article in the journal Nature summarizing the scientific consensus that sugar is the central dietary factor in chronic diseases. Quote, sugar induces all of the diseases associated with metabolic syndrome. This includes hypertension, insulin resistance, diabetes, and the aging process. A little sugar is not a problem, but a lot kills slowly, unquote. Fact 4. Sweetened beverages provide most of the excess sugar. Sweetened beverages provide most of the excess sugar. A July 2010 report by the U.S. Department of Agriculture states, quote, the average American consumes 22.5 teaspoons of added sugar per day, with almost half attributed to sodas and fruit drinks, unquote. Now let's focus on two specific harms. Harm 1. Poor health and premature deaths. Poor health and premature deaths. As mentioned in the Taubes article above, science has linked excessive consumption of sugar to the cancer, heart disease, and diabetes epidemics in our society. Harm 2. Healthcare costs are high and increasing. Healthcare costs are high and increasing. In their 2012 article in Nature, Lustig and his colleagues estimate, quote, the United States spends $65 billion in lost productivity and $150 billion on healthcare resources annually for morbidities associated with metabolic syndrome. 75% of all U.S. healthcare dollars are now spent on treating these diseases and their resultant disabilities, unquote. To address these harms, we submit the economic and health solution proposed by Thomas Frieden, the head of Centers for Disease Control and Prevention. In 2009, Thomas Frieden and others proposed this following plan. It was discussed seriously in Congress, but overturned in the face of more than $20 million in beverage industry lobbying. Mandate. The plan is an excise tax of 1 cent per ounce on every beverage with any added sweetener. That's 12 cents collected from the manufacturer on every 12-ounce can of soda. Agency is all necessary government branches. Funding, there is no funding necessary for this plan. Timing is 6 months after legislation is enacted, and the affirmative team reserves the right to clarify the plan in future speeches. Finally, let's explore the advantages of our plan. Advantage 1. Improved health and saved lives. Improved health and saved lives. Lee Goldman, MD, is Dean of the Faculties of Health Sciences and Medicine at Columbia University Medical Center. He is one of 5 authors of a joint study published in January 2012, which estimates that, just among adults aged 25 to 64, quote, over a 10-year period, 2010 to 2020, the penny per ounce tax could reduce new cases of diabetes by 2.6%, as many as 95,000 coronary heart events, 8,000 strokes, and 26,000 premature deaths. A penny per ounce tax would substantially reduce diabetes and heart disease among adults in the United States, unquote. Advantage 2. Healthcare costs reduced over time. Healthcare costs reduced over time. In February 2012, Science Daily reported on a study analyzing the benefits from a penny per ounce tax on sweetened beverages. Quote, these health benefits represent more than $17 billion over a decade in medical costs avoided for adults aged 25 to 64, with the estimated number of 860,000 fewer obese adults aged 25 to 64. And given the greater reductions in consumption among younger people, the longer-term health benefits would be far greater than the impacts during the first 10 years, unquote. This says that our plan would save an increasing amount each year through the reduction of serious illnesses in our country. In this matter, the direction of change is far more important than the speed of change. Advantage 3. Increased federal revenue. Increased federal revenue. There is a third advantage to our plan. A 2009 CBS News article reporting on Senate consideration of a soda tax stated, quote, the Congressional Budget Office estimates that a fourth of a penny per ounce tax would generate $24 billion over the next 4 years, unquote. Since our proposed tax is 4 times as high as what the CBO evaluated, our plan could generate up to $24 billion per year. However, our evidence shows that this tax will reduce consumption of sweetened beverages by 15 to 20%, so actual revenue would be closer to $20 billion. To sum this up, we have documented the deadly impact of sweetened beverages and economic harm of the diseases they fuel. We have proposed a substantial reform of U.S. revenue generation policies to save lives, improve the health of our citizens, reduce federal healthcare expenditures, and increase federal revenue. You, Judge, have fiat power to do what intense beverage industry lobbying prevented Congress from doing in 2009. Please take this opportunity to support the health of our citizens and the financial health of our nation through your affirmative ballot. Thank you.